Thank you, Mr. Speaker. Thank you, colleagues. If you set out to be liked, you will accomplish nothing, Lady Margaret Thatcher. And I understand this is a very emotional issue. I too was raised in a single home by a mom who had no health insurance, where it was oftentimes hard to get food, but also hard to get medical care. That we had no benefits from the government to get health care. So I understand that, and this is an emotional issue. But I also remember standing, just like these people up here in the gallery, on December 9th, 2009, in the U.S. Senate gallery, looking down and I hate to say it, but on TV, Harry Reid looks pretty strong, but as he walked across the U.S. Senate gallery, he looked pretty feeble that day, and I was the guest of U.S. Senator Mitch McConnell up in the gallery, looking at them debate the numbers on what we call now Obamacare, because now it's popular to call it Obamacare, where it wasn't during the election in 2012. But they were talking about all these large numbers, because sometimes they think the American people aren't smart enough to understand if we talk in large numbers, it gets a little confusing. And sometimes when we talk about this private option, that if we talk in large numbers, that the Arkansas people won't understand it. And I think sometimes we've talked, and as I've heard people talk with me, we talk about large numbers, but I think the Arkansas people do understand this a little bit. That this is an expansion of Medicaid. And so I just want to read the definition of what Medicaid is. And Medicaid is designed for those who are unable to afford regular medical services. And that's what this is doing. And I want people to understand that if we don't vote on this today, if we are a no vote, that this is not going to stop services for people from 0 to 17%. They will continue to get services. And it was alluded to earlier by my dear friends who I have fought with in the last session, and they have worked hard on this bill, and I understand it, that we may be a leader in this option, but we were told in the 2-hour testimony that was given the other day that they're not going to allow other people to do the Arkansas model. So even though they may be looking at Arkansas, no one else is going to be able to do that. And so I want to be careful in what we do today. It impacts everybody, but in my opinion, this private option is a short fix to a long-term problem. And we keep on saying there's triggers. This bill has triggers in it. Yes, it does. But if we keep taking the triggers and we put everyone from our kids B, these children, onto this, and then all of a sudden we say, oh, we're sorry, we're not going to do this anymore. What are you going to do in 3 years when us that are term limited and they come back? What are you going to do with those children? And there's going to be a whole bunch of issues here. And then I also have an issue when tomorrow, if we vote on this appropriation, when you have to put in a bill and spell it out that this is not an entitlement program, that lets me know that it probably is an entitlement program. And I also want to just state this. Yesterday I was told, and I don't mean any offense to this person that told me that, but they told me, you know, if you're part of the problem, you need to just get out of the way. And I'll tell you, just like I told my 10-year-old son, who now is 11, I said, sometime you have to stand and sometimes you have to stand alone. And that's what I'm doing today, but I know I'm not alone. So I ask today that you vote no on this private option. Thank you.